Hey everybody, it's Dr. Ryan Weaver here. Tonight we're going to be talking about ear infections and heartburn and how chiropractic care can help with those. So are you somebody who, again, deals with some of these things? Maybe you eat Tums like they're Skittles or take Rolaids all the time. Or maybe you're a parent of somebody who, a child who has reoccurring ear infections. It's something that we're seeing a lot in our office, and we've talked about earlier this year, the over-prescription of some of the antibiotics for those. Again, this is just to give you a little bit of a different insight on how you can help those children, for adults or really anybody who has reflux, GERD, heartburn, some other options. So we'll really get straight to the point after this. So again, spinal workshops, we do these every Tuesday evening. They typically last anywhere from 8 to 15 minutes because I want to get right to the point. I know most people at that time are just getting home or on their commute home. And this is something that you can just passively listen to in your vehicle. So optimum function is our key. I just want you to slow down and think about that. As you hear me reference our body as being a host often, and how we take care of that. So we want our body to function as optimally as it can. And when it does, we can fight off infections, other ailments and injuries, and we're just more protected, and we can defend ourselves. So when we get into, again, ear infections, primarily where I want to go with this is the healthier your body is, the less it's impacted by such things as viruses, infections, and bacteria. And those things are around us all the time. On tables, on door handles, again, they're constantly around us. But if you think about it, sometimes people get sick and some don't. I take care of many patients in our office, and I'm constantly exposed to these things. So I make it a priority to make sure my health is taken care of so that I don't get sick frequently. So understanding what a chiropractic philosophy and goal is to allow your body to be the best version of itself, to have optimal function, so in turn, as we were designed, our body is self-healing. And the easiest examples there, you get a cut on your arm, you break a bone. Yes, we may set it, but our body does the healing. It scabs up, it heals the fracture, and then we're good to go. So diving into the ear infections. Most commonly, you see a lot of reoccurring ear infections, and you see a lot of these are actually more virus in nature that antibiotics really aren't going to do anything anyway. But if that eustachian tube cannot properly drain, then we end up with like a swamp in our ear that viruses and bacteria happen to love. So that's why we see that. And then, if you go the surgery route, next thing are tubes and adenoids surgeries. So one of the things I want to show you here, in a really cool study that I found, there were 46 children ages 5 and under, and the outcome measurement that they used was improvement by the parent's decision. They stated that the child had no fever, no signs of ear pain, and was totally asymptomatic. But also, the child seemed to be asymptomatic to the treating chiropractor, and or the parent stated that the child's medical doctor judged the child to be improved as well. The results, again, 46 children under the age of 5, 93% of all episodes improved. 75% of those in or within 10 days or fewer, and 43% with only 1 to 2 treatments. So factors that affected the rate of improvement: a young age, no history of previous antibiotic use, that was another key, initial episodes versus recurring episodes, and the designation of an episode as discomfort rather than an ear infection were all associated with the improvement with the fewest amount of treatments. So again, one of the things that I mentioned, hopefully if you have taken an antibiotic, you know to take a probiotic as well, because antibiotics kill both the good and the bad bacteria. So again, we have to watch those. So I strongly urge taking a probiotic after the fact. So again, typically ear infections, and yes, I've seen adults with them as well, but infants, children, and our adjustments is to ease the pressure off the nervous system so that the body can communicate and heal itself. So to say that I treat ear infections is false. I treat subluxations that could result in our nervous system being compromised, which therefore could be X, Y, and Z. Low back pain, heartburn, which we're about to talk about, ear infections, what have you. So let's switch gears to heartburn. One of the biggest things that I see on my patients' intake forms that is never like one of the first things that they mention, or even maybe after the fact when I do reevaluations, do you hear, oh, hey, by the way, I used to have heartburn, I don't have it anymore. So what we see, there is some research, I've printed off a few of these articles that shows, the normal curves of the spine definitely affect association with such things as heartburn and GERD. And when we talk about the normal lordotic curve in your cervical spine, your neck, and your lower lumbar, your low back, and the kyphotic curve, which goes the opposite way, this way, in your thoracic spine, those curves all need to work together. And when any of them get hyper or hypo, meaning more or less, that can greatly affect this. So again, a chiropractor helps keep those things in the best alignment, and also the proper curvatures. So maybe we don't have the hunchback, or maybe our head's not super forward. What they found, the adjustments improve that. Adjustments specifically to the mid-back, the thoracic spine, are the the nerve innervations that primarily go to those organs, your esophagus, your stomach. That, again, as I mentioned with the ear infections, we want to make sure that those are working correctly and speaking to each other correctly. One of the additional things that I mention to patients to do is apple cider vinegar, okay? Yes, apple cider vinegar with the mother. Again, try to get the organic, the most natural version of that. You can get it at pretty much any grocery store. And again, you can take this a few different ways. The easiest way, a shot glass a day of apple cider vinegar, or even take about a tablespoon pre-meal before you eat breakfast, lunch, and dinner. And that seems to be another additional benefit besides putting something synthetically made, chemically made, such as Tums, Rolaids, and other prescription drugs as well. So, such as Prilosec. Again, my goal is to keep people informed, keep people aware and knowledgeable that there are other options besides prescription drugs and surgeries. Again, I always say this, God made a really, really good system, a smart system, and sometimes we have to really evaluate how we take care of that because your body wants to be healthy. But when we talk about 3 T's, thoughts, traumas, and toxins that press our immunity, press our body down so that it is not able to function as best as it can. Again, the first thing I talked about, optimal function. So the first thing, I would always have your spine checked by a chiropractor, make sure it's evaluated in a proper manner, our curves are where they need to be, it's healthy, there's no decay or degeneration happening. The second thing is, again, dive into these things, ask questions, comment on our Facebook page, on our YouTube page, share this with somebody, that happens every single week that patients tell me, well, we just didn't know that this could, help with hearing. That's one I just had the other day. And other symptoms like kids and ear infections or not sleeping through the night or constipation. Again, we need to put education as a huge frontline priority in our healthcare system. So thank you all for tuning in. We'll look forward to seeing you next spinal workshop. Other than that, have a wonderful time. Stay healthy.